Yes, sir, got it.
Right. So we already know that the abdominal wall is divided into 9 regions. 1, 2, 3 is the right and left hypochondrium with epigastrium in between. 4, 5, 6 is the right and left lumbar with umbilicus in between. 7, 8, 9 is the iliac fossa or inguinal region and with the hypogastrium in between. Surgeons often add a 10th region of the abdomen, which is the main external genitalia. So our focus today will be on the 10th region. It's also part of your dissection before you go into the interior of the abdominal cavity. The male reproductive system consists of the spermatic cord and the scrotum. This is a part of external genitalia. Testis and epididymis is a part of external genitalia. Only part of vas deferens is a part of external genitalia. Prostate and seminal vesicles is a part of internal genitalia. And penis is a part of external genitalia. So our focus will be today to study the spermatic cord, scrotum, testis, epididymis, and penis. As the testis traverses the abdominal wall into the scrotum during early life, it carries its vessels, nerves, and vas deferens with it. These meet at the deep inguinal ring to form the spermatic cord. It suspends the testis in the scrotum. So here we are seeing the anterior abdominal wall with the oblique muscles cut on the right side, and on the left side, the external oblique aponeurosis seen intact. What you are seeing coming through the inguinal canal going towards the scrotum is the spermatic cord. The spermatic cord in the inguinal canal receives 3 coverings: internal spermatic, cremasteric, and external spermatic fascia. The external spermatic fascia is actually not seen in the inguinal canal. It becomes a covering of the cord only after it comes towards the scrotum, after it exits the superficial inguinal ring. The internal spermatic fascia is a continuation of fascia transversalis. So that's the covering of the cord right from deep inguinal ring all the way to the scrotum. Cremasteric muscle and fascia is acquired from the internal oblique and transverse abdominis. So this becomes a covering of the cord only somewhere in between the middle of the inguinal canal and all the way up to the scrotum. The spermatic cord essentially consists of a vas deferens, which is in the core. There is testicular artery, a branch of abdominal aorta. There is a cremasteric artery, a branch of external iliac vessel. There is an artery to vas deferens, which is from the superior vesical artery. And there are sympathetic nerves, pampiniform venous plexus, and lymphatics. The scrotum is a cutaneous fibromuscular sac containing the testis and the lower parts of the spermatic cord. Remember, TES is plural of testis, TES. The scrotum consists of skin, latos muscle, and 3 fasciae: the external spermatic fascia, the cremasteric fascia, the internal spermatic fascia. The internal spermatic fascia is loosely attached to the parietal layer of tunica vaginalis. Tunica vaginalis is a peritoneal sac covering the testis on all sides except the posterior aspect. So here we are equating the anterior abdominal wall and the scrotum. The skin of the anterior abdominal wall is equivalent to the skin of the scrotum. What is peculiar about the cutaneous supply of the skin of the scrotum is that the anterior one-third is supplied by lumbar plexus root value L1. The posterior two-thirds of the scrotum is supplied by sacral plexus S3. So quite distinctly that there are two separate nerve supplies of the scrotum, whereas the anterior abdominal wall is only supplied by T7 to L1. Then there are two layers of superficial fascia in the anterior abdominal wall, the Camper's fascia, which is fatty, and the Scarpa's fascia, which is membranous. It is replaced by a single smooth muscle layer called as dartos. Remember, in the scrotum and the penis, there is no fat. So Camper's equivalent of fatty fascia is absent in scrotum, whereas both together are replaced by smooth muscle layer called dartos. External oblique is equivalent to external spermatic fascia. The internal oblique and transverse abdominis is equivalent to cremasteric fascia and the cremaster muscle. In lower animals, the cremaster muscle is quite well developed. So when the cremaster muscle contracts, the testis is pulled into the abdominal cavity and it is relaxed only at the time of breeding season when the testis goes to the scrotum. The reason why testis wants to go to the scrotum is that the body temperature there is slightly lesser, 2 to 3 degrees lesser than the abdominal core temperature, which is required for spermatogenesis. So lower animals bring the testis to the scrotum only during the breeding season. In humans, the cremaster muscle is poorly developed, it's more of a fascia. Therefore, you can't pull up the testis to the abdominal cavity. Fascia transversalis is, we said, is equivalent to internal spermatic fascia. The extraperitoneal fat. There is no fat in the scrotum and penis, so it's replaced by the loose connective tissue. And the parietal peritoneum of the anterior abdominal wall, the 9th layer, is equivalent to the parietal layer of tunica vaginalis. Then, of course, there is a peritoneal cavity of the abdomen, which is equivalent to the peritoneal cavity of the scrotum. The visceral peritoneum covering the organs in the abdomen is equivalent to the visceral layer of tunica vaginalis in the scrotum. The testes are reproductive and endocrine organs responsible for sperm production, which we said requires 2 to 3 degrees lesser than abdominal core temperature, whereas testosterone production is unaffected wherever the testes are located. The anterior aspect of the testis is convex, the posterior aspect is nearly straight. Its surfaces are smooth on all sides, except where you can see on the lateral side sinus of epididymis. The visceral layer of tunica vaginalis covers all aspects of the testis except the most posterior aspect. So testis can be thought of as having invaginated into the tunica vaginalis from the posterior aspect. Although there is no mesotestis like some of the abdominal organs have a mesentery, the deficiency of the posterior aspect is to allow the blood vessels and the nerves to enter the testis. Posteromedially, the visceral layer is reflected forwards to the parietal layer. Posterolaterally, it lines the epididymal sinus and then passes anteriorly. So here we are seeing the testis, which is the oval-shaped structure, and the posterior aspect, which is where the peritoneum is not covering, is for the blood vessels and the nerves, and also leaving the testis in the upper aspect is vasa efferentia, which then continues as ductus deferens. And then ductus deferens continues as vas deferens. So ductus epididymis, which is continuing as vas deferens, is also called as ductus deferens. Remember, the epididymis has got a head, which is called as caput. Epididymis has got a body, which is called as corpus. Epididymis has got a tail, which is called as cauda. The epididymis is a highly coiled structure, so the total length of the epididymis is 6 meters, similar to the length of the small intestine. Whereas ductus deferens or vas deferens is 18 inches long, similar to the length of the thoracic duct and femur. The testis has got 3 coverings on the outside: visceral layer of tunica vaginalis, tunica albuginea, tunica vasculosa. The tunica albuginea sends septae, dividing the testis into lobules. The lobules contain seminiferous tubules, which all of them will join the vasa efferentia, continuing through the epididymis. The penis consists of an attached part called as root or radix in the perineum and a free body which is also called as corpus. Now, what is perineum? The diamond-shaped area bounded anteriorly by pubic symphysis, posteriorly by the coccyx, on each side by the ischial tuberosity. The anterolateral boundaries are formed by istiopubic ramus. Posterolateral boundary is an imaginary line joining ischial tuberosity with the tip of coccyx. This diamond-shaped area is divided by a transverse line to form 2 triangles, anteriorly the urogenital triangle, posteriorly the anal triangle. Also notice, these 2 triangles are not actually in the same plane. The anterior triangle, urogenital triangle, is more or less horizontal. The posterolateral triangle, anal triangle, is more or less coronal. So, perineum literally stands for peri means around, and neum means outlets. So, urogenital outlet and the alimentary tract outlet, the region surrounding them is called as perineum. So, penis consists of an attached radix which is attached to the perineum and a free body corpus. The root of the penis consists of 3 masses of erectile tissue in the urogenital triangle, left and right crura and the bulb. Each penile crust is attached to the everted edge of the istiopubic ramus covered by istiocavernosus. The 2 crura continue as corpora cavernosa. The bulb of the penis is covered by bulbospongiosus, which then continues as corpus spongiosum. So here we are seeing the 2 crura covered by a muscle, that is the istiocavernosus, and the bulb, which is in the center, which is covered by bulbospongiosus. The 2 bulbospongiosus on either side join together in the midline, forming the bulbospongial raphe. The muscles are restricted to the perineum, but the deeper structure, the crura and the bulb, continue into the penis as the corpora cavernosa on either sides and the corpus spongiosum in between. The corpus spongiosum contains the urethra. uh, the body of the penis is usually described as if the penis is erect. So the abdominal surface of the penis is called as dorsum, and the perineal surface is described as ventral. So the corpora cavernosa share a common fibrous envelope, the tunica albuginea. Remember, the covering of the testis is also tunica albuginea. The covering of corpora cavernosa and the corpus spongiosum is also tunica albuginea. The tunica albuginea literally means dense connective tissue. The two corpora cavernosa are separated by median fibrous septum. The corpus spongiosum is traversed by the urethra. The corpus spongiosum expands anteriorly to form the glans penis. The corpora cavernosa stop at the glans. It's a blind end at the glans penis, whereas the urethra continues into the glans penis and the glandular urethra till it reaches the external urethral meatus. So here we are seeing a schematic transverse section, a three-dimensional transverse section of the penis. You can see the two large cavernous spaces, the corpora cavernosa, separated from each other by a median septum, and the corpus spongiosum relatively small with the urethra lying. There is an additional layer of fascia which is covering the penis, which is called as the buccal fascia. It is a thickened equivalent of Scarpa's fascia of the abdomen. So this buccal fascia ensures that the vessels which are within the buccal fascia do not have space to expand, whereas those vessels which are superficial to buccal fascia can easily expand. So superficial dorsal vein, which drains the skin and the prepuce of the penis, are free to expand and can allow the blood to go back to the superficial and deep external pudendal veins, which then join the saphenous vein to join the femoral vein. In contrast, on the dorsal aspect of the penis, deeper to the buccal fascia, in the midline lies the deep dorsal vein, single structure. On either sides of it are dorsal artery, and further lateral to that is the dorsal nerve. The dorsal nerve is sensory to the glans penis, and the dorsal artery supply blood to the glans penis. The internal pudendal artery gives an additional deep artery of the penis. The deep artery is also called as the cavernous artery because it supplies the corpora cavernosa, and there is a separate artery for the corpus spongiosum. When the parasympathetic nerve supply is supplying the deep dorsal, cavernous artery, the deep artery of the penis, it causes the vasodilatation. Parasympathetic causes vasodilatation. So what happens is that cavernous spaces expand, and because of the unyielding deep fascia, the deep dorsal vein is compressed. So artery comes to the penis, it cannot flow out. That's how the penis remains erect. Whereas after the parasympathetic supply is replaced by sympathetic fibers, there is vasoconstriction of the arteries, which allows the vein to slightly expand. The deep dorsal vein does not join the femoral vein. Deep dorsal vein actually goes past the gap between pubic symphysis, below the pubic symphysis, and enters the prostatic venous plexus. Prostatic venous plexus is a very low pressure system. So the deep dorsal vein can freely flow and rapidly flow into the prostatic venous plexus. So that's why it is said that human males get erect very fast But the resolution phase is also equally fast because of prostatic venous plexus, which is a low pressure system. There is no corresponding prostatic venous plexus in the females. That's why the erection of the clitoris in females is slower and the resolution is equally slow. The penis is supported by two ligaments, the fundiform ligament and the triangular ligament, the body of the penis. The fundiform ligament arises from the linea alba, splits into two lamellae, which encircles the penis and unites below with the scrotal septum. The triangular ligament arises from pubic symphysis and support the body of the penis. The artery of the bulb of the penis is a branch of perineal artery. Perineal artery is a branch of internal perineal artery and supplies the penile bulb and corpus spongiosum. That is the artery of the bulb. The deep artery of the penis is a terminal branch of the internal perineal artery and supplies the crus penis and corpus cavernosum. And there is a dorsal artery of penis which is also one of the other terminal branch of internal perineal artery and supplies glans penis. The deep dorsal vein drains the three corpora, the corpora cavernosa and corpus spongiosum into prostatic venous plexus. The superficial dorsal vein drains the prepuce into external perineal veins, which then join the saphenous vein to enter into the femoral vein. The corpus cavernosum of penis receives both parasympathetic supply for vasodilatation and sympathetic supply for vasoconstriction, and there are also dorsal nerve, which is sensory to glans and the penis skin. So with that, we come to the end of the discussion of male external genitalia, the 10th region of the abdomen. If you have any questions, you can ask now.